Let's talk about dog bites. I made a video talking about how people will use nipping or other euphemisms to describe what is actually a very serious bite. And people in the comments did bring up that it often happens the other way around, where people use the word bite when really their dog has been giving some sort of warning snap or a very inhibited bite. And in the caption of that video, that's exactly what I was getting at. We use very different words to describe very different things, right? And so what's a bite for one person is a nip for another. This is why it's so important to operationalize these terms. This is why if you go to a behavior consultant after your dog has bitten you or someone else, they're going to ask you a lot of details about that incident itself, including some very specific questions about the injury. And oh my God, there's so much that we could talk about here. But the other point that I was making is that people also have varying thresholds for the level of risk they're willing to accept and the level of injury they are willing to accept to themselves when the bites are family directed. This is probably going to take multiple videos to cover the topics that I want to cover, like why we don't look at the medical intervention that's chosen when we determine the severity of a bite. Whether or not you chose to go to the emergency room and what the doctor decided to do about your injury is not part of the risk assessment. And we could also talk about how when these wounds are being treated, sometimes they are made to then look a lot worse than they did originally. And so we have to be able to gather information about what we saw before medical intervention, which can be tricky, right? But before I jump ahead to all of that, let me know if you have questions. Let's talk about bite scales. Because I referenced bite scales in that video. Bite scales can be used to determine the level of inhibition in the bite. It kind of equalizes whether we have a very big dog or small dog. We can still talk in this way about the level of inhibition. And that helps us to determine somewhat of the severity of the incident, although again, that's very subjective. And it also, though, really allows us to determine risk assessment. It's part of our risk assessment going forward. Bite scales are not the end-all be-all to a risk assessment. There's a lot that they don't consider, like context, which is very, very important, and a lot of other factors. But it does let us look at the inhibition and arousal levels of the dog. This is Dr. Sophia Yin's bite scale, the late great Dr. Sophia Yin, and illustrated by the lovely Lily Chin. You can also look up Ian Dunbar's bite scale. 30 seconds, let's go. Level 1 is a snap. It's an intentional miss. You did not miss your dog's bite. We are not fast enough. Dogs bite faster than we react. So a snap is an intentional, very inhibited near miss. Please get away. Level 2, bruising, perhaps some superficial breakage of the skin, less than 1/10 of a centimeter. We are not looking at punctures here. Very inhibited. Most bites are level 1 or level 2. Dogs have sensors halfway up their canine teeth that say, all right, that's enough. You've bitten far enough. Level 3 is under that threshold.